So in this PowerPoint, I'm going to focus few question and answer about the respiratory disorder. This question and answer is extremely important for your NCLEX licensing exam because I'm going to talk about acid-base balance. I'm going to talk about the chest tubes, and also I'm going to talk about some respiratory diseases. In this PowerPoint, I wrote 100% pass guaranteed. But this 100% exam pass guarantee is only applied to the candidate who pass our exit exam prior to taking the board NCLEX licensing exam. Because we prepare our student such a way, if they sit for the licensing exam, they will get it. The first question here, a registered nurse is asking the client care of the assessment. So which staff member should be assigned to the client who had a chest tube, right? So your patient undertaking the critical condition, so they need the chest tube, right? The patient who need chest tube, we always need to assessment of the patient. We need to evaluate the patient. So if I ask you, who assessment the patient, who evaluate the patient, definitely your answer would be RN supposed to do this, right? So it is the role of RN, not LPN. So they say the charge nurse, nursing assistant, we call CNA, licensed practical nurse or LPN, or registered nurses, right? So correct answer is the registered nurse. So when we need to put the chest tube, this patient need assessment. So assessment of the client is a role of RN. Determine the plan of care, role of RN. So when need to care the most critical patient, unstable patient, always RN supposed to assign to take care of them. Like a patient come after the surgical operation, fresh post-operative client. The client with a change in the condition who need assessment, or during the admission, RN supposed to there. During the discharge, RN supposed to there. During the transfer, RN supposed to there. Right? So registered nurse always perform the most complex procedure. For example, starting the IV channel, interpreted electrocardiogram or EKG, also correlating the lab yellows, very important. So the rationale said, according to the National Counseling of State Board of Nursing, delegating and compresses fibroids, the right ducts, the right circumstance, right person, right directions, and right communication. It is the right for the patient and also right supervisions and evaluation. The registered nurse is the most appropriate caregiver to assign to the client with a chest tube because the chest tube system require frequent assessment and need to monitor. In addition, the client may require immediate nursing intervention should the chest tube become obstructed or become dislodged. So this is the reason a registered nurse supposed to take care of it, take care of this patient. You can see a picture here. This is the chest tube. Because of some reason, the NCLEX board like to ask the question from chest tube. Here I'm going to explain a little bit. So a chest tube have three parts. So all chest tube system have three chamber, easy way to explain. One is called water seal chamber. This is the collecting chamber, or this one is called suction control, right? You see the air leakage monitoring. So three chambers, very important to know what are the function, right? Or it is also important to know what are the function of the chest tube, right? The function of the chest tube to remove the air from the lungs. You see the picture? When we need to remove the air or remove the fluid from the pleural space, so you see the tube here, collect secretion come inside the chest tube. So chest tube sometimes re-expand the lungs, or chest tube we use for hemothorax. Hemothorax stand for blood in the pleural space, or pneumothorax. Pneumothorax stand for air in the pleural space. Sometimes if patient have both, means blood and air both inside the pleural space, so-called hemopneumothorax, we need the chest tube. So the indication of the chest tube, one is hemothorax, pneumothorax, and hemopneumothorax. It is important to remember that normal breathing works on negative pressure. When patient has a tension pneumothorax, also we use the chest tube. So it is the medical emergency. The client needs the treatment right away through the chest tube. So if I go back here, I said the collecting chamber, water seal chamber, and suction control chamber. It is very important. Every student must know for board exam, because NCLEX asks this question. So like you working as an RN in night shift, so keep it note, always we could keep the record, the drainage. Every 8 hours or every shift, we collect or measure the amount inside the collecting chamber. So also, if any abnormalities we found, we notify the physician. If the drainage is greater than 100 ml per hour, or if the drainage in the collecting tube is bright red, it indicates hemorrhage occur. We notify healthcare provider. About the water seal chamber, always make sure nothing comes. Always make sure nothing comes in while the air come out. So always water seal chamber is one way valve is there. So in water seal chamber, if we see continuous bubbling, it means it is bad sign. It indicates the leakage. In water seal chamber, if we see intermediate bubbling in water seal, it is a good sign. What else? The suctioning control chamber. In the suction control chamber, we always amount of the suction should applied. So always we should keep some water inside. And also continue suctioning is important, and doctor determined how much fluid suctioning need for the patient. About the bubbling, in case of suction control chamber, continuous bubbling in suction control chamber is a good sign, and intermediate bubbling in the suction control chamber is bad sign. It is opposite in the water seal chamber. Now let me read something for you. So what we wrote here? So they said what are the nursing intervention? The patient who take the chest tube always need to high polar position. We need to monitor vital sign. Oxygen is prescribed. Also, chest X-ray is important. Dressing over the open wound. Wound means this area is wound, we call it, because the chest tube inserted here. Prepare the chest tube, replace if this loss occur. So intervention means the care of the client with the chest tube. So assessment the patient for respiratory distress, or it is important to assessment of the patient for breath sound, or check your patient is stable or not stable, means check the vital sign. So when we put the chest tube, always try to should be placed below the chest level. So you see, this is the chest, and chest tube is below the chest level. And daily X-ray are needed to check the fluid removal. And also the client will have occlusive bracing at the insertion site. We never clamp the chest tube without doctor order. The patient who under the chest tube procedure, always make sure the water seal is, pull the chest tube, beside the patient bed, always we should put some equipment like occlusive dressing, clamping, also sterile water. Now let me go back. So chest tube return negative pressure to the lung space. Also remove the fluid or air or promote re-expansion of the lungs. So this is the indication or use of chest tube. So what are the evaluate? Disposable system follow the 3-bottle system that I told you. Chamber 1, chamber 2, and chamber 3. It is actually collecting chamber, water seal chamber, and suctioning control chamber. So chamber 1 say collect the fluid, drain from the client. Chamber 2 serve as a water seal. Intermittent bubbling and fluctuation are normal with inhalation and exhalation. As I told you, water seal chamber, continuous bubbling is not good, but intermittent bubbling is a good sign. Excessive bubbling or continuous bubbling indicate air leak. If there are no fluctuations, assess the lung sound, and we should call to the doctor. There may be obstruction or lungs have re-expanded. NCLEX board asks the question from here. And chamber 3, it is the suction control chamber. So suction set at 15 to 20 centimeter as prescribed. The nurse should see the gentle continuous bubbling. So continuous bubbling in chamber 3 is a good sign. Intermittent bubbling in chamber 3 is a bad sign. Now monitor, when your patient have it, we should monitor the respiratory status, monitor the dry, sterile, and occlusive dressing. We check the chest tube or label the bottle with a date and time. Tell the patient to expect the pain when they cough. If the drainage is more than 100 ml per hour, is excessive, and we need to notify doctor. So have the clamp at the bedside for an emergencies. Never clamp unless system breaks. If the tube is disconnected or dislodged, place the tip in sterile water until the system can be replaced. Also, two chest tube on the same side. Top drain air and bottom collect the fluid. So remove a chest tube. Definitely when patient is going to be good, we need to remove the chest tube. So have the patient inhaled, then exhale. Tell your patient, do this. Also hold exhalation for tube removal, we call Valsalva maneuver. Very important for NCLEX board. Also, place the occlusive Vaseline dressing to the side and place on unaffected side. Obtain the chest X-ray. A client with a pulmonary embolus and has the following arterial blood gas values. The pH showing 7.49, partial pressure of arterial oxygen showing 60 millimeter of mercury, and partial pressure of arterial carbon dioxide showing 30 ml mercury. Bicarbonate ion 25 milliequivalent per liter. What should the nurse do first? Number one, instruct the client to breathe into a paper box. Number two, admit oxygen by nasal cannula as ordered. Number three, auscultate the breath sound bilaterally every 4 hours. Number four, encouraging the client to deep breath and cough every 2 hours. So student can answer this type of question. Two type of student can answer. The student who really know what is blood gas analysis, they can check each and every values, and then they decide what are the problem, what should do. Another student also can answer who do not know anything. How? Like there are 4 options. I do not know this. Still I can answer. Reason being, like out of 4, I said it makes sense if it is imbalanced. Admin oxygen by the nasal cannula. Oxygen giving is life-saving as needed. So if you see any question as needed, as ordered, as prescribed, usually it is the answer. This formula you can follow if you do not know the answer. Another way you can see, always try to, if you see any option raising, it is also the answer. Now you may ask me, if as needed, as prescribed, or courage is together, what I will do? Both is positive, but here is the more important oxygen added. So this is value is more, because as needed and encouraging is a positive word you can choose. I'm just talking about some clues, right? So you have to choose the oxygen first. So if number 2 is not there, you can think about number 4. Now let me go the brilliant way to answer this question. So this patient has a history of pulmonary embolus, right? So embolus means blood clot formation, and this clot, when passing through the narrow circulation like lungs or brain, they fall in stark and causes the blocking, right? So in that condition, we need to check arterial blood gas analysis, shortly called ABG. So arterial blood gas test basically measure oxygen and carbon dioxide level, right? So you see, arterial oxygen level is 60, and also arterial carbon dioxide level is 30. So every student must know what are the normal pH values, what are the normal carbon dioxide values, and what are the normal oxygen level in your blood, right? So normal blood gas analysis, what are the normal pH? It should be 7.35 to 7.45. So it also measure your body acid base level, which is usually in balance when you are healthy. So you may get this test if you are in hospital or if you have a serious injury or illness. So when you see the pH 7.35 or in between 7.35 to 45, it is neutral. If you see pH is less than 7.35, it is acidic. If it is more than 7.45, it is alkaline. Here what? 7.49, right? It is more than 7.45 means it is alkaline. So if it is alkaline, it either metabolic alkalosis or respiratory alkalosis. Keep it note, easy way to explain. If any disease related to our gastrointestinal system, like pancreatitis, diabetes complications, right, vomiting, nausea, usually that type of problem is either metabolic acidosis or metabolic alkalosis. If any problem related to the lungs, like COPD, bronchial asthma, a marathon runner, it is problem either respiratory alkalosis or respiratory acidosis. And who can distinguish, is it acidosis or alkalosis? pH. So the normal blood gas, when we study, it is determined acid and base balance. And always keep this note, when we need to check the blood gas analysis prior to ABG check, always we can do the LN test. Very important for NCLEX board. So now let me go back here. So second question, partial pressure oxygen is 60. So what is the normal? Partial oxygen supposed to 80 to 100 millimole per liter. So partial pressure oxygen is less than lower normal limit, but pH is more. So if pH is more than 7.45 and oxygen level is less than 80, right? What should be? So another options here, also carbon dioxide. Arterial carbon dioxide is 30 ml. So here the carbon dioxide is not indicator partial pressure of carbon dioxide. It is 35 to 45, right? 30 means less than this 35. So carbon dioxide, partial pressure of carbon dioxide indicator of is it alkalosis, respiratory alkalosis or respiratory acidosis. This is the marker. And bicarbonate ion is here 25 milliequivalent per liter. So what else? It is within the normal range, right? So basically 3-row formula we have to know to answer this type of problem. So pH is the indicator to differentiate between acidosis or alkalosis. If it is less than 7.35, it's acidosis. If it is more than 7.45, alkalosis. And the partial bicarbonate ion is the indicator of metabolic. It is metabolic problem or respiratory problem. And the partial pressure of carbon dioxide are the indicator of is it respiratory alkalosis or respiratory acidosis. So usually the formula said that in case of respiratory acidosis, pH is supposed to be less than 7.35 bicarbonate and within the normal range, but partial pressure of carbon dioxide is supposed to more than 45 millimeter of mercury, more than upper limit. In case of respiratory alkalosis, pH less than, more than 7.45 because alkalosis. Bicarbonate is supposed to normal because and partial carbon is a marker for respiratory problem. In case of metabolic acidosis, pH is supposed to less than 7.35 because acidosis. Metabolic, so partial pressure of carbon dioxide is supposed to normal because it is a marker of respiratory problem. And bicarbonate ion, it's supposed to less than lower limit, less than 22 milli equivalent per liter in case of metabolic acidosis. In case of metabolic alkalosis, means pH value more than upper normal limit, 7.45. It is metabolic, so bicarbonate ion supposed to normal. It is not a marker. Metabolic, so bicarbonate ion is a marker. Partial pressure of carbon dioxide is normal. It is more than upper normal limit. Easy way to remember, we call Rome method, ROME, means in case of respiratory, acidosis or alkalosis, pH and partial pressure of carbon dioxide is supposed to opposite. ROME. ME means me. Me is a special. Means M means metabolic. And if means equal. Means in case of metabolic acidosis, pH less than lower limit. Bicarbonate also less than normal limit, lower normal limit. Metabolic alkalosis, pH is more than 7.45. Bicarbonate is more than upper limit. So it is called ROME, Rome method. So here few of the example. Some if it is calculation is hard, just try to remember what are the example of metabolic acidosis and what are the example of metabolic alkalosis. What are the example of respiratory acidosis and respiratory alkalosis? So let me explain one by one. In case of metabolic acidosis, keep it note, diabetic ketoacidosis or diarrhea, renal failure, shock, aspirin overdose, and sepsis. Example of metabolic acidosis. So easy way to remember, anything except vomiting or anything except suctioning all GIT problem or GIT related problem are metabolic acidosis. In case of metabolic alkalosis, example is a vomiting or suctioning like pyloric stenosis. Example here, loss of gastric secretion means vomiting, overdose of antacid, potassium wasting diuretics. So any problem related to vomiting or suctioning, it is metabolic alkalosis. So loss of gastric secretion through the vomit, overdose of antacid, we need suctioning. What else? Respiratory acidosis and respiratory alkalosis. Let me explain respiratory alkalosis. When the breathing is too fast, like hyperventilations, means breathing is too fast. Hypoxia, you have a less oxygen, but you are struggling to air, so your lungs is hyperventilated, trying to compensate, breathing too fast. Anxiety lead to the breathing too fast. High altitude, pregnancy or fever. Example of respiratory alkalosis. Respiratory acidosis, the breathing is too slow, like hypoventilation, COPD, like asthma, bronchitis, emphysema, airway obstruction, drug overdose, chest trauma, pulmonary edema, or neuromuscular disease. So what else? So what are their rationale? So when a pulmonary embolus places a client at the risk for oxygen deprivation, the body compensates by hyperventilating, right? So hyperventilation, it is the breathing is too fast, right? Respiratory alkalosis. And this causes respiratory alkalosis is reflecting in the client arterial blood bellows. However, the most significant arterial blood gas bellow is the partial pressure of oxygen, and it is below 60 millimeter of mercury, which is indicate hypoxia, right? So the oxygen saturation also we can get by pulse oximetry. It is also help you to identify your patient has a hypoxia or not, right? So to manage hypoxemia, the nurse should increase oxygenations by administering oxygen via the nasal cannula as ordered. Also instruct the client to breathe into a paper bag would cause depressed oxygenations when the client is re-inhaled carbon dioxide. Auscultating breath sound or encouraging the deep breathing or coughing would not improve the oxygenations.